Good morning to all my friends, colleagues, past residents. I hope you are all well. This is the very end of September in Minneapolis. We're having summer weather, no fall weather in sight, but we shall get it, and then our typical snow in the winter. Raphael kindly asked to take a video if I can remember the history of research, pathogenesis research, and otopathology, and how it all got started, since we in Harvard are the two largest in the world in terms of collection of temporal bone cases and in terms of teaching students from around the world. Really, it started when I was a third-year medical student at the University of Michigan. I always had two jobs during medical school and during residency, and in the one job was I had a band, and we would do a couple of jobs at the Hillel House and high school proms. I played trumpet and sang, and we had other people, just 4 or 5 piece band. Although one time Toledo, Ohio wanted an 8-piece band, so we had a couple of people come along and they just held their instruments, but they didn't have to play. We cheated a little bit, sorry about that. But in that year, my other job was to do histories and physicals for the professors at the University of Michigan at St. Joseph's Hospital, where they saw their private patients. And I saw time after time after time, TNA, tonsillectomy patients, septum patients. They came home happy, smiling, and those moribund patients. So I thought, well, maybe I need to go into ENT. So once again, during my third year in medical school, I said, well, I want to be an ENT doctor. I talked to the chairman of the department, and he said the only 3 schools that are really good that you should go to are Iowa, Harvard, and of course the University of Michigan. That kind of scared me off. So I heard of a young research person with a reputation who had just arrived from the University of Chicago, which was the strongest research program in the United States during those decades. Dr. John Lindsay, Perlman, assistant chairman, Dewey F., many others, but the one person who moved to Detroit, Michigan and developed otopathology plus other related research was Dr. Harold Shuknek. So I started visiting him when I was a third-year medical student, and they only had 2 residency positions, and so I locked up one even as a third-year medical student. Later, there was a doctor who wanted to take a residency there, but he couldn't because I took the last one, and that was Paul Ward, a good friend of mine who became chairman at UCLA. I was in Europe at the time, and so then I took my internship in Emmanuel Hospital in Portland, Oregon. Then I came back to Shuknek at the Ford Hospital, which is kind of like the Mayo Clinic. He had established a nice research program, so I joined him. And in my first year, I started doing research. I was doing research every evening, and we would train cats, behavioral conditioning, to get an audiogram, which would take months. Then we'd do a lesion, and the first publication I ever had was, my first publication was a high-frequency micro-vibrator bioacoustical effects. But just to demonstrate that otopathology isn't just pathology, we can do many other research disciplines around this. And we trained animals to get a very accurate audiogram. Then we would use high frequency as an attempt to pulverize the stapes for cases of stapedectomy. Instead, it became a high frequency trauma study. It won the research award in Michigan, the Kobrack Research Award. He was a very famous researcher. And so that began my research time with Shuknek. We did many other things. In the first year, I created a plastic glass 3-dimensional project for the whole inner ear. It was beautiful. And we did other studies and so forth. And in fact, towards the end of my residency, Shuknek had a large meeting of all the best otologists, in the United States and other countries, and he asked me to give a paper on trauma in the inner ear, which I was scared to do. That was my first speech. Then, in my senior year, 1961, Shuknek surprised everybody and was nominated to become professor and chairman at Harvard University. The people at Harvard, some of them were not too happy about that. They were entrenched with their own East Coast feelings, but he went there and he wanted me to do research. I had an obligation to go into the military because that way they wouldn't draft me right out of medical school. Obligated volunteer, the Berry program is what it was called. And so he wanted me first to go to Graybiel in the panhandle of Florida, where the Navy did huge buildings, were doing Coriolis research and so forth. Well, it turned out Shuknek couldn't put me from the Army into the Navy. So then he found Galambos, who was a very famous neurophysiologist in ear research, who was at Walter Reed Hospital. But then he, at the last minute, was recruited to University of Hawaii. So I said in my form, I definitely want to stay in the United States and do research. Instead, they drafted me to France, and I ended up in Germany. But I also had a great 2-year experience. I visited the universities. A dear friend, Al Holman, and I made a wonderful movie on how to do animal cat surgery, including brain surgery, Broca, by Dewey Neff, who did that part, who came from the University of Chicago. And that film and my little speech at all these universities was very educational for me. And so after 2 years, I came back and joined Al Shuknek at Harvard. And this would be 1962, I guess. And then the year following that was tumultuous. A lot of things happened. My wife had a brain aneurysm, and the chief of neurosurgery did an operation using a method of some kind of plastic material that they put on top of the aneurysm, and she had serious problems for the rest of her life until she passed away. So we did a number of publications, but while I was at Harvard, I had an opportunity to visit the University of Zurich in Zurich, Switzerland. And Rudy was the professor and chairman, and he had 2 docents. One was Hugo Fish, he was wanting to be the next chairman, and the other was a wonderful research person. And so they let me have access to everything. This was a large historical collection dating back to the turn of the 19th century. I had a lot of Pendrid's cases, that's iodine deficiency, in the Alpine area. And we showed how the stapes is buried by bone in a tunnel on both sides. And we had a lot of other cases. I was studying children's deafness, which the Germans called back then Taubstummheit. But Taubstummheit means deaf and dumb. So obviously we stopped using that a long time ago. But nevertheless, I took this large collection back home. And Shuknek was so surprised, he visited the Zurich hospital on 2 additional occasions. So then in 1963, I was recruited to become the first otologist and to do the first otology and temporal bone pathology laboratory surgery research at Ohio State. And we had a good relationship with the chairman, who was an amazing guy. He was a general ENT guy, but he saw so many patients in one tiny office. But he was very supportive of me, so I was there for about 3.5 years. And I started, although I had previously helped study or help support other fellows that were Shuknek's fellows, I had my first independent fellow at that time, and he was Dr. David Lim, who has become a wonderful human being and a fireworks of research, having been a research director at NIH and then became research director for the House Institute. I was honored because he named his son Michael after me. I was his godfather. He named his name, and then I became his godfather. Quite an honor. And he did amazing research while at Ohio State. But then 3.5 years later, I was recruited at the age of 33, I think the youngest chairman, at the University of Minnesota. I wanted David Lim to come, but Jack Duval, who was also an electron microscopist, wasn't going to leave, so therefore David did not come. He did a lot of wonderful work after that. So then I started to develop the research program. They had some people doing some good research, and we pulled them together and added a few. And we had a wonderful research team. We had our own electron microscope. We had psychoacoustics. And of course, otopathology was the largest lab of several labs in our department. And so we did research there until actually I ended my tenure. Since I was chairman for 18 years, did a lot of things. I was head of the Council of Basic Sciences. Then they voted for me to be chairman of the Council of Clinical Sciences, which meant all 18 clinical departments. We helped a couple of departments to become departments, as they were under general surgery previously. But after 18 years, I decided to follow my father's advice. He said, "Figlio mio, my son, ma che pazza? Are you crazy? You spend 3 to 4 months out of the year going this university, that place. When are you going to get a job?" He thought a job meant I was on a corner seeing a lot of kids who had tonsillitis and stuff like that. But we went there. We stayed there for 18 years. During the 70s, we got unusual at that time. We got 2 grants. I was principal investigator of both of them, with almost 10 or more research disciplines, each of which brought in $1 million. And since then, the laboratory has been productive. It's had its down period during COVID and so forth, but it's been very productive, and we now have a collection that pretty much matches Harvard, which is more than 2,000 temporal bones, not counting a large number of thousands of animal specimens for research. So otopathology has been my life, and it's not just pathology. The key word is pathogenesis, which means etiology, actions, mechanisms, biochemical, whatever, until the pathological state. If the pathology causes symptoms, then the patient sees the doctor, and then we have a diagnosis and treatment appropriate. So that helps the diagnosis. But the word pathogenesis involves etiology and all the processes that lead to pathology with the symptoms. So you're seeing the whole ball of wax. And that way you better understand the disease, and you better understand how to treat patients. So we came up with a lot of new findings, a couple of new diseases, and maybe too many publications. I thought I had 157, and Fact GPT said I had 800. But most of them are refereed. That includes 27 books, and it includes this book, Just Another Immigrant's Son. And it's a history of my personal and professional life, and of course, it's a history also of the otopathology pathogenesis laboratory. And so in the future, we've got a small number we'll keep alive for those who really would like to get a copy. And it describes also the history, as I say, of our laboratory. But our laboratory has gone on to new areas of responsibility. For example, NIH designated our lab, the leaders of whom are Meredith Adams, Seventeen Corioglu, and Raphael, who spends all day helping to do the work, as a center for the hospitals designated to promulgate otopathology research for other universities. We hope that can happen. That includes Hopkins University, Harvard, UCLA, and Stanford. And ours is the center, administrative center, to help that happen, and we hope it really does happen. Years ago, Rick Cole, one of our best residents who became chairman at Washington U, wonderful person. He wrote an article in the archives of otolaryngology. He stated that, we have a serious problem. We only have 22 otopathology laboratories in the United States. Well, before this NIH designating our center for those 5 universities, there were 22 at that time, and more before. So we've gone way downhill, and we need to bring it back. So we are still working on new projects that I hope and believe will enlarge our program in a very significant way, but also other programs which is our designated requirement to help NIH promulgate otopathology laboratories elsewise in the United States. Now, research, a lot of good research, new findings. Also, almost as important, maybe more important than all the research publications our laboratory, probably 1,000 or more, has accomplished, is education. Now, we've educated more than 100 residents, several of whom became chairman. I mentioned Rick Hole, Bill Meyerhoff, there's so many. So it's about 30 professors and chairmen we educated through the lab, and many, many more who are faculty members or practicing the field and teaching. And so education, medical students have been through our laboratory, residents, but especially international fellows. And just recently we found that the number to date of international fellows from many countries, mostly Japan, Brazil, but many other countries, it was about 211. So our laboratory has been very prolific and very productive in education, in research, and in helping doctors treat their patients. It's very important. These are the only universities in the world, there are none other that look at temporal bone pathology because it's so difficult to process and to study those things. Fortunately, we have a brand new equipment that lets us get better resolution, which is also a benefit for helping to see better resolution and to get better results from research. It's been my life. It's been a pleasure. I've had great happiness in seeing that laboratory and our people. I'm delighted with our present director who's running the lab, Rafael Monsanto, and we're looking to future horizons to expand and to enlarge what we have accomplished to date, and to include all of our fellows and past students who've been such great contributors themselves. Thank you for listening to me, but I would like to add a few words of thanks. So many people have helped me, I can't possibly list them all, but of course I want to acknowledge my family. Since I spent so many evenings working in research or just working, studying, etc., I have to thank them for their forbearance. All of them were amazingly supportive, including my first wife who died of a sad death. And I had a wonderful wife, Treva Paparella, who's been a wonderful, wonderful partner and just super great and helpful in every regard. I want to thank all the people who helped me in my research endeavors. Of course, once again, I would mention Dr. Harold Shukneck of Harvard. He trained not only me, or gave me the opportunities to do research at Harvard and elsewhere, but he also trained others who have become leaders. So he has become a large magnet for research in the world. And we knew him personally. We would go to his home. And so he really was the single most important individual who influenced my professional academic life. But there were other people who helped. The doctors and professors at Washington University promoted me for the Otological Society, for the Collegium. I barely knew them, but they promoted me, and thanked them profusely. And they're a great bunch of people. And as mentioned, Dr. Rick Hole was their recent chairman, our past resident. We've trained so many good people that have done so many good things. I can't mention them all, but I thank them all, and thank all who came to study with us, to help us, and to help their own careers. We thank all of our friends and all of our colleagues in and out of the profession of otolaryngology and otological research. Thank you for listening to me, and I hope you have a chance to learn more by visiting or approaching our laboratory. In the meantime, good luck, God bless, and thank you for this interview and this opportunity. Thank you very much.